All new Pacific Mornings with Will on 531 PI.
It is 7:34. You're listening to Pacific Mornings on 531 PI. I'm William Terite. It's great to have your company this Wednesday. Now, Health New Zealand's Whatu Ora is extending its cost-cutting measures to last 3 years and signalling more voluntary redundancies while reporting a deficit of over $700 million. Now, its Chief Executive Margie Upper says while significant changes have been made in recent months, further change is needed to live within budget. Joining me for reaction to this and more is former Whatu Ora Chair Rob Campbell. A very good morning to you.
Good morning, William.
Look, it looks like a shambolic mess, if I'm honest, from the outside looking in. But what do you make of the state of Te Whatu Ora at the moment?
Well, it looks like a shambolic mess because it is one, William. It's been one for quite a long period of time. This is not new or the fault of Te Whatu Ora. Te Whatu Ora is picking up all the faults of mismanagement and underfunding of the system for many years, which they're trying to deal with as best they can. I think the real tragedy that we have now is that by endeavouring to live within an inadequate budget, what the leadership of Te Whatu Ora is doing is placing the burden of all this on patients and staff, the ones who are least able to deal with the situation. You can't cut your way out of the problems that we have of underspending in health.
Well, look, and that kind of leads in naturally into my next question here. Because of these cuts that have been signalled and perhaps even voluntary redundancies as well were signalled, will that not inevitably lead to a worse public healthcare system?
Yeah, I mean, the short answer to that is yes. There's no doubt some changes that needed to be made, and there probably are still some in the health system where some resources need to be reallocated from here to there. It wasn't very efficient, and it's still not very efficient. But that does not mean that you need less people in the system, but it may mean that they need to be doing different jobs. And so the current situation is frankly increasing the chaos, it's increasing the stress on staff, it's decreasing the service to patients. And for Te Whatu Ora to be trying to pretend it's not doing that, I think it's very misleading. They have to be standing up and saying to the government, you need to fund your way through this. This is something created over many years, and you can't expect the staff to pay the burden for it. I was on the nurses' picket line yesterday, and nurses are only part of this. On the nurses' picket line yesterday, there was genuine distress about what they were having to go through. I know, for example, that the Pacific teams are all being restructured yet again. They've had several goes at them, both in the head office and on the ground. And so the wrong people are facing the stress and the difficulty of this.
Yeah, let's go there with the changes to the Pacific teams there. I mean, what do you think that instability could lead to worse outcomes for Pacific people?
I think it will inevitably lead to it. And when you look at these huge numbers, that the billions of dollars and the hundreds of millions of dollars that people talk about, they're not something which has been caused by overspending on Pacific Health or Māori Health or public health services that are needed in the working class districts in New Zealand. They've been largely caused by bad expenditure, poor budgeting and underspend on major capital projects. This is not a result of having too many people working at the coalface, and yet that's where so much of the pressure is being absorbed.
I was looking at, obviously it's scrutiny week at Parliament at the moment, and I was looking at Health Minister Shane Reti. He was alongside Upper at a select committee, and basically, I mean, Aisha Vera put it to him as in asking, did you engineer a crisis? I mean, is Reti exaggerating the poor state of Health New Zealand? What do you make of that? Is there an ounce of truth there?
No, look, there is a crisis, and so I don't think Aisha Vera is right about that, and there was plenty she could have done when she was minister that she didn't do as well. So she doesn't get off scot-free, nor do any previous governments. So I don't think it's manufactured. There is an underspend on health. Not all of the spend has been properly allocated, but that is not an excuse for seeing the way out of the problem being to cut staff and cut expenditure where it's badly needed. So what's happening is we're worsening the health crisis rather than dealing with the health crisis.
Are you still an advocate, or do you still believe in Te Whatu Ora, obviously, since it's reorganised from the DHB system?
Yeah, some form of Te Whatu Ora was absolutely necessary. Whether Te Whatu Ora itself is the perfect structure is another question. And, of course, we've lost Te Aka Whaiora. We haven't done enough. We never did in the initial stages do enough about supporting Pacific Health needs or indeed other migrant community needs. So I think a lot of the things that people think was wrong with the way Te Whatu Ora was set up were actually the best things about it, and we're losing them. But did we need to go through this basic reform structure? Yes, we did, and we're still a long way. There's something like $14 billion worth of deferred maintenance in the health system that should be spent on health facilities. That's before you get to the new hospitals. And so trying to deal with issues like a few staff here or there is just a ridiculous misestimation of the problem.
Look, in your time when you were with Health New Zealand, was there ever discussions, or I'm sure there were, but just for a bit of context, indulge my question here, in terms of other nations that are doing well with a public healthcare system that New Zealand perhaps should have modelled off?
Well, in the preparation for Te Whatu Ora, there was an enormous amount of that went on, studies and discussion about it, and it continues. I'm sure it continues to this day. And a lot of the issues that we have in the New Zealand health system are shared with other systems like ours. If you go around the world, people often refer to the UK, to the NHS. It has most of the same problems reflected in different ways, and so do most of the health systems. Part of it is demography and the increasing demand for health services, the increasing expense of these things, the ageing of the communities. There's lots of reasons why we have these things in common. But the New Zealand health system is not, in my view, a very bad example amongst them at all. It's just we could be doing so much better.
There's this idea that it's been floated about in media in recent weeks of more Kiwis departing the public healthcare system for private. Now, I don't know what world that's in, certainly not in my world, but do you think that there is that appetite for those that can afford it switching to private?
Oh, look, I think there's a tremendous problem for our public health system, and that we are getting up towards half of our population have private health insurance, and therefore don't think they do need to worry about the public health system. And week by week, month by month, they don't. If they get something serious, then it becomes a much bigger issue. But that has eaten away at the integrity of our public health system. So the partial privatisation of our system that we've seen, which I think is going to continue, and I think actually is part of this hidden agenda. The more you cut services, the more you cut your capability to deal with things in the public sector, the more people will switch over to the private sector. Now, of course, William, just a minute, when you switch over, it might solve your problem, but the costs don't go away. The costs of healthcare are still there. And if you look at what's happening in private health insurance now, they are not finding that their costs are going down. They're finding that they're going up pretty much the same way the public health system is.
Just to follow up on that statement that you just made there. So when you say that perhaps there could be that hidden agenda, just for clarification, you mean by this government? I know that the ACT Party particularly is keen on private healthcare or privatisation.
Yeah, I don't think they've manufactured this crisis because I think the crisis is real, but I think the way they're reacting to the crisis is to do with how to increase the private provision of healthcare and diminish the responsibility of the community in this respect. Quite deliberate.
Interesting. Hey, well, thank you very much for your time this morning. I really appreciate your expertise as always. You have a good rest of your day.
Cheers. Bye.
You are listening to Pacific Mornings on 531 PI. I will be back with you in just